Well, for months, hospitals across Indiana have been enduring a surge of new COVID-19 patients. The National Guard, deployed through an executive order by Governor Holcomb, is helping tired and overwhelmed healthcare workers cope with this latest surge. Reporter Brock Turner visited multiple Indiana hospitals last week and has more on the latest wave of the pandemic.
That's right, Joe. Nothing can really prepare you stepping into the ICU or a med-surg unit at a hospital right now. The floor is full of largely unvaccinated COVID patients. Outside the negative airflow rooms, communities have returned largely to normal, but the healthcare workers and system caring for them is at a breaking point. Jamie Schutte and healthcare workers across Indiana are overwhelmed.
Our workload is quadrupled.
Schutte is a respiratory therapist at Mary Margaret, a critical access hospital in Batesville. During non-emergent times, this facility cares for 25 patients. Today, there are nearly that many COVID patients on the floor, and even more with other conditions require hospital stays.
We are keeping twice and 3 times the normal number of patients that we are used to seeing. Our inpatient volume has been very busy. We are having issues with staffing and being able to fill nursing shifts, respiratory shifts, issues with provider coverage.
Schutte is just one of a handful of respiratory therapists here and has seen a lot over the course of the pandemic.
What scares me is seeing, since I'm from the community, is seeing family or neighbors, friends that come in and I have to take care of them, which in a small community, you kind of know everybody, so it kind of makes it hard.
The problems facing Indiana hospitals aren't isolated to Mary Margaret. Across the state and country, healthcare is being pushed to the brink. Experts say unvaccinated COVID patients paired with a number of clinical staffing shortages is testing an already tattered system. That's in large part why an order from Governor Holcomb, who has joined fellow Republicans in resisting calls for further COVID-19 restrictions, allowed the National Guard to be deployed to a number of Indiana hospitals. One of them is Clark Memorial in Jeffersonville.
It's been a real boost for us to have an extra pair of hands, and that's really what we needed, was somebody to come in and at least give us a couple weeks of an extra pair of hands to help with those things that we want to do but just haven't had a chance to get to.
Guard members can only be deployed at a hospital for 2-week periods.
We go back to where we were, and we continue on without the help, which means everybody picks up a little bit more.
We were supposed to visit the ER as part of our visit, but hospital staff told us it was too crowded. Schmidt and other hospital administrators admit the care patients are receiving is not always at the level they would desire.
To be honest, does it scare me a little? Yeah, it scares me a little, but I feel like, you know, we are being flexible to make sure we take care of who we can, and we make sure that those people we can't take care of, we get to an appropriate place that they can get care.
And the hospitals equipped to provide more intensive care are stretched thin, too. Many Indianapolis area hospitals admit they've spent significant amounts of time on diversion. Some, like the state's largest health system, IU Health, have canceled all elective inpatient procedures.
There's a bottleneck. It's the state of Indiana. It's our transferring facilities in Indianapolis and in Cincinnati and not being able to transfer appropriately.
That lack of staffing and physical space create ripple effects for small critical access hospitals like Mary Margaret.
That gets scary when you're a critical access hospital and you're trying to figure out how to get patients appropriately where they need to be. And the reality is, if there's nowhere for them to go, they're staying here.
Royce admits her hospital now keeps sicker patients longer because there is just nowhere to transfer them throughout the system. Her frontline staff experience it daily.
Normally, we have patients come in, you're with them for 2 or 3 days, they go home. COVID patients, we're with them every day for a month or better, and then sometimes they don't get to go home. You learn a lot about them before they get too sick to be able to talk. You get to know them. It makes it hard.
For Indiana News Desk, I'm Brock Turner.
We've been hearing about this for so much. To actually see it just gives it so much more meaning. Can you tell us a little bit more about how the National Guard was deployed?
Yeah, there's really only one person in the state with the authority to deploy the National Guard, and that's the governor. While Holcomb's office has attempted to distance themselves from these deployments, insisting that the order that authorized them is not new, that really isn't true. It's been routinely renewed. While the State Department of Health is involved in some of the planning, that doesn't really happen without this executive order from the governor.
So what are some of the tasks they're doing?
It really varies by hospital, but at a high level, they're doing a little bit of everything. It's important to clarify there are two types of soldiers under this deployment. One are working in critical roles, the other in non-clinical roles. Those soldiers with medical credentials are providing actual patient care for hospitals that are short-staffed with high patient volumes. Others are doing more administrative and custodial work, which takes a lot of the burden off of the other staff. The hospital I attended, for example, last week, talked about had soldiers assigned to administering COVID tests.
So is there any light at the end of the tunnel? What are they saying?
Experts tell me there could be. Both new cases and hospitalizations appear to be slowing, but keep in mind, though, hospitalizations do tend to lag about 2 weeks behind new cases. While the state surge might be waning, local health officials still are concerned about the number of Hoosiers vaccinated, and there's always a chance future variants, much like the ones that spread the Delta variant, could emerge.
All right, Brock, thank you very much.
Thanks a lot, Joe.